Hello everyone, I am Tabassum and my colleagues Vidya and Manashwini would like to share the information regarding adverse drug reaction, its classification and more about it in this video. Welcome to Clinosol YouTube learning channel. To gain the more knowledge from us, subscribe our channel by clicking on the bell icon. Here you can get the information related to scope, job opportunities, courses, career by CSSF team members. First of all, we all should know what is ARIA. So, it is defined as a response to a drug which is noxious and unintended and which occurs at doses normally used in humans for the prophylaxis, diagnosis or therapy of disease or for the modifications of physiological function. Now, let's get into the topic we are discussing.
It includes adverse event, adverse drug reaction, serious adverse event, and adverse drug reaction classification. Adverse event. It is defined as any unfavorable and unintended sign, symptom, or disease temporarily associated with the use of the medicinal product. It may or may not related to the medicinal product or treatment. It is an unexpected medical problem that happens during treatment with a drug or other therapy. Adverse event may be mild, moderate, or severe and may be caused by something other than the drug or therapy being given. Adverse drug reaction. It is a response to a drug which is noxious and unintended and which occurs at doses normally used in humans for the prophylaxis, diagnosis, or therapy of disease or for the modifications of physiological function.
Now we will discuss about adverse drug reaction classification. Sometimes these reactions can be avoided by doctors and pharmacists. Types of adverse reaction based on Rawlins and Thomson classification. Generally, the adverse drug reaction are classified into 5 types. Those are type A, type B, type C, type D, and type E. Now we will see one by one. Type A effects, which is also called as augmented effects. These can happen due to pharmacological effects, which is dose related and related to pharmacology. Example is hypoglycemia due to insulin. And the second type is type B effects, which is bizarre effects. These reactions also called as idiosyncratic reactions. These are generally rare and unpredictable, non-dose related and unrelated to pharmacology. Example includes anaphylaxis due to penicillin. And the third type is type C effects, which is chronic effects. These type of effects occurs after long-term therapy of medicinal product. Example is colonic dysfunction due to laxative and NSAID-induced renal failure and GI effects.
And the fourth type is type D effects, which is delayed effect. These type of effects may occur years after the treatment. Example include vaginal tumor in daughter as well as mother when the mother was treated with diethylstilbestrol during pregnancy with a history of miscarriage. And the last type is type E effect, which is end of treatment. These effects may occur when the drug is stopped or suddenly stopped. Hence, this is also called as the bound effect. Example is corticosteroid in asthma treatment. This type of effect is unrelated to established pharmacological effect. It may not be shared with pharmacological groups. This effect may lead to serious organ damage. Pulmonary fibrosis is a serious organ damage with sulfasalazine. There is a poor relationship to the drug. This is generally uncommon and difficult to detect in drug development. This type of effect cannot be avoided if the drug is used. Patient idiosyncrasy is a major factor. Some examples of unpredictable reactions are affect. Chronic use of methotrexate produces a condition called retroperitoneal fibrosis. It is a rare condition and it occurs when excess fibrous tissue develops in retroperitoneal areas or in the spaces behind your stomach and intestine. Clindamycin causes a condition so-called pseudomembranous colitis, which refers to swelling or inflammation of the large intestine due to an overgrowth of Clostridioides bacteria. Chloramphenicol produces a condition called aplastic anemia after its chronic use, as a result of damage of bone marrow. Hence, the body stops producing enough new blood cells. With chlorpromazine, there is a condition developed called cholestatic hepatitis. Hence, need for the liver transplantation. And now we will discuss about serious adverse event. An adverse event is any undesirable experience associated with use of a medical product in a patient. SAE includes six criteria. Those are death, life-threatening, hospitalization, disability, congenital anomaly, other serious important medical events, and cancer, which is newly added. If the patient outcome is any of these events, should be reported to FDA. Now we will discuss one by one. Death. If you suspect that the death was an outcome of an adverse event, should be reported to FDA and include the date if known. Life-threatening. If the patient was suspected that he was at substantial risk of dying at the time of adverse event, or use or continued use of the device or other medical product might have resulted in the death of the patient, should also be reported to FDA. Hospitalization, which may be initial or prolonged. Report to FDA if admissions to the hospital or prolongation of the hospitalization was a result of an adverse event. Emergency room visits that do not result in admissions to the hospital should also be evaluated for one of the other serious outcomes. Example includes life-threatening required intervention to prevent permanent impairment or damage. Other serious medically important event. And the fourth one is disability or permanent change. Report to FDA if the adverse event resulted in a substantial disruption of a person's ability to conduct normal life function. That is, the adverse event resulted in a significant, persistent, or permanent change, impairment, damage, or disruptions in the patient's body function or structure, physical activities, and a quality of life. And the next one is congenital anomaly or birth defect. Report to FDA if you suspect that exposure to a medical product prior to conception or during pregnancy may have resulted in an adverse outcome in the child. Report if you believe that medical or surgical intervention was necessary to preclude, that is, prevent from happening permanent impairment of a body function or prevent permanent damage to a body structure. Either situation suspected to be due to the use of a medical product. Last one is other serious important medical event. Report when the event does not fit the other outcomes, but the event may jeopardize the patient and may require medical or surgical intervention to prevent one of the other outcome. Examples include allergic bronchospasm, which is a serious problem with breathing, requires treatment in an emergency room, and serious blood dyscrasias, which is a blood disorder, or seizures or convulsions that do not result in hospitalization. The development of drug dependence or drug abuse would also be example of important medical event. And cancer, which is newly added. Seriousness criteria based on intensity. Those are mild, grade 1, moderate, grade 2, severe, grade 3, life-threatening, grade 4, and fatal, grade 5. For mild intensity, the characteristic is awareness of sign, symptom, or event and the intervention is tolerated or no or minimal intervention. For moderate intensity, the characteristic is discomfort enough to cause interference with usual activity. It may warrant intervention. If the intensity is severe, it includes the characteristic like incapacitating with inability to do usual activities or significantly affects clinical status. It warrants intervention. You can contact us or write a mail us on the following. Thank you for your attention. Please write your genuine queries in comment section and send us to our team. We'll get back you soon. Thank you.